At the beginning, I would like to thank Dr. Sham. Sham is a good friend. I have known him for the last 20 years, and then I can see how he is developing his own idea in the form of idea clinics. For today's session, what I thought we will do is that I have about 2 or 3 slides to get the discussion started, because I think it is quite important going forwards how we can shift the focus from treatment to prevention. I think is important both for medical reasons, for ethical reasons, for moral reasons, and most importantly, for financial reasons as well. Prevention is far, far cheaper than treatment. Next slide, please. So, how we wanted to plan today is I just wanted to ask individual panel members their opinion on how to prevent or how to create a platform or create an environment where prevention is as important as the treatments which we are doing. Next slide, please. So, what are we at the moment in? We are in reactive, expensive, repairing and replacing organs is the time I call today. That is, I am a clinician, I am a cardiac surgeon. In the morning I go and then do bypass surgeries. But that is the end result. This is, I call this as an acute treatment. That is not what this today's discussion is about. It is about how we can prevent a patient from coming to my operating table. That is the discussion. And at the same time, how to make it affordable. Because I will tell you, patients will come to the hospital and be willing to pay few lakh rupees for bypass surgery. But take their story back 10 years and tell them, get a 20,000 rupees test, they will not get it done. And that is the truth about today. And that is where we need to make some changes is what I think. Next slide, please. The other aspect is India is going to become a big economy, no doubt about that. But if you see the top 10 hospitals in the world, we don't come there yet. Our clinical load is huge. Our variety is huge. In the West, I have worked in the UK for 13 years. I can tell you 25% of the workforce in the UK is Indian doctors. I'm sure the same is the case for the US as well. So we don't have dearth of clinicians and specialists at the world level, but we don't have institutes at the world level. And I think that is another aspect which I wanted to raise. The next slide, please. And how do we integrate? How can we use integration of data, of information, of newer technologies, of preventive models across the country? So this is the reason why I think integration of the existing data, of the existing expertise is also equally important in, again, my first statement about preventing of diseases in our country today. Next slide, please. So, from sick care to well-being care, and how can India shift from reactive treatment to proactive prevention? So with this, just the next 3 slides, sir. Next slide. So first question to the panel. How can India shift from hospital care to prevention? Again, mind you, this is a wide variety, and Sham has done an excellent job in choosing people from different walks of life with very, very different backgrounds to answer the same question, how do we prevent diseases? So how can we use technology instead of hospitals to improve care? And then next slide, please. How can we cannot replace hospitals. That's not the point here. But while we focus on prevention, how can we make our hospitals into world famous institutes? So this is a slightly a side question, but the main question still to the panel is how do we improve our preventive strategies? I don't want that patient to come to my table at all. So, but I have to catch him 10 years earlier and then make sure that his blocks are kept at 10% or identified much early and treated so that he doesn't end up having a bypass surgery. So, next slide, please. Next slide, please. So what reforms and partnerships are needed to make prevention a reality? Next slide, please. And how do we integrate? There are so many players who are involved in providing health care, providing preventive care, providing medical care to the patient. So how do we integrate all these for finally the common man to benefit? Next slide, please. So that's my background to the panel. So I would request Dr. Vinay Nandukuri sir to first give an opinion about preventing and how you see from your angle, from a scientist's angle.
Knowledge. We have to actually focus on knowledge generation. In the context of if you are talking about diseases, some of them are actually lifestyle, but there are quite a lot of diseases for which there are bases, genetic basis. And wherever there is a genetic basis, such as an example would be sickle cell anemia, where there is a single mutation in your genome, and that single mutation, like father has single mutation, mother has single mutation, when ultimately when the marriage happens, and 1 in 4 chance that the child will have sickle cell anemia. So those kind of things can easily be identified well in advance. There are many other small mutations here and there which are known to make you are at risk for heart disease, at risk for breast cancer, at risk for many of the other things. So this particular knowledge is likely to be different